learning health system is around for a few years, and it's being adopted in numerous different jurisdictions around the world as a way to improve the efficiency and activities and quality and value associated with healthcare. And the CIHR have put it in our mandate as a major pillar for phase 2 funding of what we're doing today. So it would be relevant to talk about it anyway. But it has also been picked up, as Catherine said, by Health Accord NL, and it is a component of their approach to transforming health in the province. Now, they've gone a step further than the CIHR, though, and we're not just talking about a learning health system, but rather a learning health and social system. So I'm going to focus a little bit on that distinction today as well.
Is it Melissa?
What's that?
The arrow.
I've done arrows, I've done mouth, I've done third. Oh, got it. Yeah, thanks. Okay, so many people will know what I mean when I say social determinants of health, but really what we're talking about is everything about your life that can impact on your health. So it can be where you live, how you eat, what kind of educational resources you have access to, are you financially secure, and all these things make a big difference. In fact, they have much more impact on your health than does traditional healthcare. So in this slide here, you can see the relative proportion of health impact resulting from various factors. And the top box, your life, how you live it, the fortunes you have, etc., has the biggest impact. Healthcare itself has a much smaller impact. So for that reason, if you're interested in improving health of a population, as opposed to just the healthcare system, then you really have to include a focus on these social determinants. So the Health Accord did pick up on that, and this is their statement and call to action. It says, integrate the social determinants of health together with a rebalanced health system into all governance, policy, program, and infrastructure decisions to influence health. Now, I apologize again, I can't read my slides because I have eyes. There is, in their document, a compelling case made for doing this. So these are several of the drivers that need to lead to transformation. So we've heard from the SearchCon group a little tiny aspect of the crisis we're having in health. We also, of course, have lots of data supporting the fact that the population here is less healthy than it could be. There's substantial demographic change. The province is aging, and it's one of the oldest in the country. Sustainability of the current model of healthcare is certainly very questionable, and there definitely needs to be changes made to ensure that it's working for us as we all get older. We're not full of money, though, so we can't just do this by throwing cash at it. And of course, there's been calls from the premiers to the federal government to put more money in, but simply putting money into healthcare doesn't achieve outcomes that you want. You have to be more strategic than that. And then finally, we're all suffering from the impacts of climate change with yet another storm coming this weekend, hopefully nothing like the last one. In addition to that, there are some specific things that would impact on health and healthcare. So the cost of care is going up. We've got increasing digitization, which could be a good thing, but it can also be a challenge. So we've heard about cyber attacks this morning already. We've got a complex care system. It's very organized in silos. There's multiple aspects: primary care, you've got emergency care, you've got long-term care. We've heard about some of them, but do they all work together? Can you talk to each other and make sure that there's a seamless transition as people use the system? There are many faceted provider groups. So we've got multiple different kinds of providers with different skill mixes, and there's a lot of focus on team-based care and having people work to the full scope of their capacity, but interprofessional interactions and seamless transitions between providers is still a complex challenge. People have many different health conditions, so you may be unfortunate to have one thing wrong with you when you're younger, but by the time you get older, you often have multiple different health conditions, and there may be competing priorities in trying to optimize people's health. There's an expectation that we'll be able to provide more interventions, so we're doing a lot more now than even in 1987 when I came here first. And then finally, we have a lack of integration or a lack of information about what's actually working. So it takes a lot of effort to get the kind of information that came out this morning in terms of how the emergency departments are working. That should be normal for us to know that sort of thing. So what we're aiming for is often characterized as a quadruple or even quintuple aim. And what we've done to adapt this a little bit is to ensure that the components of the aim are actually relevant to a system that integrates the social determinants as well as the healthcare system. So there's a focus on equity in health, workplace well-being, which would be the providers and the people working in the social care systems, valuing their jobs and being happy about them. We would like to see value for money. So if you do put in more fiscal resources, that you get out the outputs that you're hoping to achieve. That we have improved outcomes, so that we're not here in 10 years' time saying, well, we do have the worst cancer outcomes, the worst heart outcomes of the country. And then we do need to focus on pursuit of better health, which will include a lot of preventive and lifestyle interventions. So in terms of what the Health Accord did, they visualized this pathway to change as being built on two pillars that are interconnected. And one of the pillars is the social determinants of health, and they're listed there. And then on the other side, you've got a quality health system with various components relevant to the quality. I'm going to let you read those because honestly, I can't. But the ultimate aim is to have better health outcomes and increased health equity. So their solution, in part, was this call to action to foster a culture of quality and establish a comprehensive, effective, and sustainable learning, health, and social system. So what I'm going to be talking about from here on then is what is that and how do we get there? So this is a direction statement, which they have in their document, and it's built on definitions of learning health systems adapted now to include the social aspect. So it says one in which there's a role for scientific information, there's education of people, the public, the providers, the decision makers, policy makers. There's a use of informatics to inform decisions. There's the use of incentives to drive behaviors in the right direction, and a culture which are aligned for continuous improvement. So it's all about continual improvement and learning. There's integration of innovation. So we want to look at new things, not just because they're new, but because we need to do things better. And obviously, if we're learning, we'll have to evaluate those innovations. And then there needs to be a strong focus on equity. So it's no good to be doing the best you can for one small segment of the population while others are suffering or left behind. There will be best practices seamlessly embedded in the delivery process. So you see that a little bit in terms of the SurgeCon. They're doing their best to develop best practices and put them into the normal daily activities. There would, in all elements, be a generation of new knowledge, and that would be an integral byproduct of the way the system works. So as we do things, we're actually able to capture a lot of information as we go, both about healthcare processes and how the social care systems work, and use that information to establish learning cycles. So these systems, the learning systems, can be at different levels within whatever organization you work for. So they could be at a small level, say within an academic health science center, or they can be national. So the examples I've got here is showing the Swiss National Learning Health System. If you were to go further though, and say, are there good models for learning health and social systems across the country? There really aren't. So we're going to have to try and build that from the ground up a little bit with help from everybody. So there's a role here for the public, what we could call patients who are informed public with a health lens, but we'll also need public with a social lens. And all this will have to happen as part of the rollout of the transformation of the health system. So as you know, this has become fairly topical because the legislation that was introduced to establish a single provincial health authority got a pause when there was a need to consider what do you mean by a learning health and social system? What do you mean by quality council, etc.? So some of those things have been put out for further discussion so that we do have an opportunity to actually debate this. What do we want this to look like and how should it function? in the context of any new health and social system. So we're talking about cycles, and there's various kind of learning cycle diagrams that I could show you. This one comes from the health report. They liked it better than the one I had. So I said, okay, I'm happy to learn. In the middle, you've got a problem. So the problem could be a gap in services. It could be a poor outcome. It could be a costly approach. It could be an issue with your provider availability, whatever it is. And then you start your cycle there at the top, looking to really understand this problem. Then you work through gathering data on the problem itself. We've heard talk this morning about barriers and enablers. You often have to use various types of frameworks to understand things that will make this work, which will help you drive the change in the direction you want. Then you have to kind of co-develop some kind of novel process or intervention. And I say co-develop because this is also a role here for your informed public, etc. And then you put this in place and you assess it and you see how well it works. That's exactly what's being done with SurgeCon. And then if it does work, you do what they hope to do as well, which is spread and scale. So you move things out into the broader environment if it's the best practice now. So these kind of learning cycles would be integral to the functioning of a learning health and social system. And as you can see, you would need people, you need data, you need analytic and interpretive capacity, you need knowledge mobilization tools and processes, and you need ways to scale and implement things. And all those are additional skills and resources that we may or may not actually have at the moment. So these are some of the key components of a learning health and social system. So there's the culture where people feel that it is important to learn, and there's an environment that's conducive to that. So right now it's very difficult, for example, for those overworked staff in emergency, and I keep coming back to that example because it's topical, to learn new ways of doing things because they're so busy with what they're doing. We'll have to think about how we can work on that. There needs to be proper full engagement of what we're calling patients now, but when you broaden this out, it will include residents in long-term care, it would include recipients of social services, it would include people who are vulnerable or at risk. And I'm seeing examples of this across the country in CIHR calls for proposals, for example. We are seeing patient-oriented research proposals that engage vulnerable populations as patient partners. There needs to be a digital capture. Now we have a relatively, I'll call it not connected digital environment for health here, and the same with the social system. There's a lot of silos, a lot of old systems, a lot of vulnerabilities. And if we need to move forward and capture data appropriately that will help us to understand problems and develop solutions, we'll have to think about how we can do that properly. Then that data, of course, needs to be managed properly. So there's been issues brought up about, well, privacy and so on. That is a good time now to have that conversation to ensure that the data being captured are secure and that they're best used for the purposes that we intend. We need to produce timely research and evaluation evidence to help support decisions. That's happening now, but it just needs to become a little more pervasive. And there need to be appropriate decision supports and knowledge translation. So a lot of this is, you can learn stuff, but nobody knows you've learned it. And yet it can take like 20 years for a research finding to make it into clinical practice. I'm pretty sure, talking to people in some of the other systems like education, justice, etc., can be just as long for novel and better ways to do things to make it into new ways of behaving. We will, of course, then need all sorts of appropriate competencies for rapid learning and improvements informed by our implementation science. And then there does need to be a strong governance model for this, which includes the appropriate financial resources and delivery mechanism. Underpinning all of this, there are a number of values. Now, these would be, we thought, appropriate both for a learning health system and a learning social system. So there's a focus on persons. So we're having to go beyond calling it patients because it now extends out to families and communities as well. There's respect for privacy and all the other things around there that you can read. I'm not going to read them myself because I'll make a mistake. But I think most of these would be principles and core values that people could get behind. When I read them first a number of years ago, I was saying, okay, that makes sense. And this here is a diagram adapted to illustrate how a learning health system might be visualized. But we've adapted it now to make it possible to encompass the learning social system as well. So those core values I just showed you are on the bottom. They're the bedrock on which all of this is founded. Then you have a number of pillars which encompass the things that you need to have in place, integrating across them to make this happen. So you have things that are based on social factors, the way people behave and interact with each other. You'd have, on the other end, regulations and laws that support the functioning of a learning system. You'd have to have appropriate policy systems and data capture, interpretation, etc. And then this ecosystem for change would work through a series of learning cycles, which are mobilizing knowledge to action. And there are different stages in the process. You can see them there. So you've got data to knowledge, knowledge to policy, and policy to action, and around again. So there's always an iterative or repetitive nature to these cycles. You're never finished, really. You're always trying to learn more. And at the top, you can see the real goal, the quintuple aim that we're aiming for. And I won't reiterate those components. So one of the things that would be inside this, an engine, if you like, is a bridging mechanism. So this gets you from what is the issue? You've identified the gap, the problem, on the left-hand side there in the darker blue. So there's a generation mechanism to generate issues. Then you have in the orange, can somebody read that? Selected, right. So there'll be a ton of issues, right? So we can't really necessarily put a lot of resources into solving every problem all at once. So there needs to be some mechanism for identification of what are top priorities, what needs focus. Now, there'll be issues that can be dealt with at team level. So the team will have their priorities, but there's also system-wide issues that will need attention. And there needs to be a mechanism to balance all of these priorities. Once you've identified what you want to work on, you then have to go out and find the evidence. So what's known already, and this means you may have to have a shop capable of doing rapid evidence reviews. You may have to do a bit more thorough synthesis. Some people mentioned synthesis yesterday. And then you also need people with data capture and analytic capabilities who are able to understand and parse out the problem for you. Then you need a co-development of solutions. So this would involve designing new ways of doing business, essentially, depending on the problem. And then you need some kind of way to implement this into practice, and you go back again through your evaluation cycle, capturing metrics of success or failure of your implementation. So what we would need here for any of that to happen is strong leadership and full engagement across all levels of the systems, a way then to identify these issues that we're interested in, and to get the input of everybody, whether it's persons, families, communities, workers, decision makers, and researchers, in terms of what are the things that should be looked at. We need some kind of management system for data. Now, there is such, but obviously it needs to evolve. And there needs to be probably systems to embed learning cycles within our practices. So some teams would be well able to do learning cycles now. Others would have to start from the bottom up and say, what the hell is a learning cycle? The same applies at the system level. As we talk to people mostly within the health system at the moment, there are a plethora of different entities, say within the health authorities, that deal with quality, efficiency, finances, human resources, etc. And they're not all integrated together in a way that would make it easy to set up a learning cycle that's appropriately resourced. And then at the end of the day, you need mechanisms to disseminate your findings beyond what we're doing now, like a traditional conference or paper doesn't always get to the people you need. As our first team talked about, when they want to reach policymakers, they're going to have to reach public health and people who might make a decision in the future about locking down or not a nursing home. And all of this has to be within a culture that makes sure that everybody sees the benefit in doing things the way we're proposing. The systems have influences from multiple levels as well. And this is pretty clear that healthcare and other systems don't exist in a vacuum. So there can be influences from people up to families, up to communities. There can be a variety of different kinds of learning opportunities across boundaries. And there are various frameworks, like mentioned today, I think already, was the consolidated framework for implementation research. But when you start to work across multiple levels and across both health and social systems, these frameworks don't always match your needs. This is just an organizational learning chart showing you the various operations within an organization, going from the individual, who could be, say, a nurse or a physician, up to a team. It could be an interdisciplinary care team in a community, for example. You'll have a middle level management, and then you've got the organizational management. And then outside that, you're in an operating environment, and finally the general environment. So everything from the way decisions are made to work together, say, with a partner community organization, to help people's mental health in a community, to integration with municipal councils in environmental design to ensure that health is optimized. All these kind of things would have to be thought about. And at the same time, we need to be careful to keep our eye open and watch for health equity. And there are a number of frameworks. I'm just giving you one example here of the PETAL framework, which is aimed at integrating health equity into the work as it goes forward. And the components of that are to prioritize the equity, engage the community, target disparities, act on data, learn and improve. So those kind of ways of thinking would work well with a learning health and social system. There can be some ethical challenges. Certainly at the beginning, you could say there's a moral imperative to continuously seek best practice and consistently apply it. I don't think anyone would say it's a good idea to do stuff in a shoddy manner. Health equity may be advanced so everybody can contribute to knowledge generation and will benefit from the appropriate use of knowledge. The existing frameworks for ethical review of research are designed with a particular view of research. That can be challenged when you start to get into learning cycles. There is a distinction, for example, in the minds of the Human Research Ethics Board as to what's quality improvement versus what's research. The two overlap. And as you get into doing process improvements, you may end up with saying, well, who should be looking at this from the point of view of regulation? So we may need to look at adapting the current regulatory environment a little bit to account for the need to do these learning cycles in an efficient manner. And all of the learning health and social system decisions should be based on a transparent contact between people, families, and communities and their system. So if people know and trust what's going on, they're more likely to allow you to use their data to help themselves. There's an accountability to implement best practices and a necessity to be ethical. Here are some of the key challenges. These were identified by interviewees who were being asked about what they thought were bigger issues that would make it difficult for them to implement a learning health system in particular. But I think the same concepts would probably apply if we asked people about how would it be if you wanted a learning justice system. So organizational culture, data systems and ability to share data, funding the learning activities, the supply of skilled individuals, managing competing priorities and regulatory challenges were all brought up. And I think all of those certainly would apply in our context. But wherever there's challenges, there can also be strategies to help you overcome those. And these were some of the things that were identified as being important to underpin transformation in this direction. So a strong leadership, a strategic prioritization process, building on existing strengths, enhancing your training programs, which may mean changing the way we educate people. So graduate education, for example, can be, you can imagine how that could influence this. Purposeful design of your data system. So if we get into a new data system for the province, having in mind that you want to use the data for this type of purpose would be important. We have our hospital information systems based on Meditech right now. Great for an individual patient care, I can say, from delivering that, but horrible if I want to get system-wide information quickly. And then you need internal transparency of your quality metrics. So when you talk about what you think indicates you're doing well, make sure people know what you're saying. There needs to be an alignment and integration across the academic and clinical systems and the social system. So in other words, the strengths that each will bring can support each other. We're having, for example, ongoing conversations with the Research and Innovation Group in the Health Authority about how can quality of care NL work together with you to actually co-achieve what we both want, which is in fact the same outcome. So thank you very much for that, and